you'll learn. After you finish this lesson, you will be able to identify health and safety agencies, list contact information for common agencies, explain how to report violations.
Legal implications. A healthcare facility may be held liable for any injuries or accidents that result from negligence or malpractice. Accidents do sometimes happen, but every member of a healthcare team must do their best to maintain a safe environment. When an accident happens or safety violation occurs, it must be reported to the supervisor right away.
Malpractice and scope of practice. Negligence is unintentionally harming a person by acting in an improper way. In other words, if people do not act in a way that a reasonable person in their situation would, they are guilty of negligence. Malpractice is professional negligence. It is the most common charge against healthcare workers. Malpractice occurs when healthcare workers unintentionally harm patients as a result of not following their profession's scope of practice. Scope of practice is what healthcare workers should and should not do according to their profession. Each healthcare profession has a scope of practice. Each state has laws that define the scope of practice for each healthcare profession, but each state's laws share general characteristics.
Legal implications. Liability. Liability refers to being legally responsible for causing harm. Healthcare workers are liable if they commit a criminal offense. They are liable if they do not meet the established standards of care. And they are liable if they breach a contract. If healthcare workers cause harm, liability may extend beyond them. The following are 3 levels of liability that may occur in a healthcare setting. Personal liability refers to healthcare workers being responsible for causing harm. Supervisory liability refers to supervisors of healthcare workers being responsible for workers causing harm. Supervisors are liable because subordinates are expected to work according to the supervisor's management, and the supervisor is responsible for providing adequate supervision. Employer liability refers to employers of healthcare workers being responsible for workers causing harm. Employers are liable because employees are expected to follow the employer's policies and practices. The employer is responsible for hiring qualified personnel, providing an appropriate environment, and providing adequate supervision. Reducing liability. There are several ways liability can be reduced in healthcare settings. These include following policies and procedures, keeping proper documentation, filing event reports and keeping anecdotal records, using problem solving, and applying risk management. Policies and procedures. To reduce liability, healthcare workers should follow their facility's policies and procedures. Policies are the principles that direct the facility's activities. Policies state what the facility does. Procedures are the methods the facility uses to carry out its policies. Procedures explain how the facility operates. For example, in order to prevent exposure to environmental pathogens, a hospital has the policy cleaners and disinfectants will be used appropriately. The procedures used to carry out this policy are then described. For example, in order to clean and disinfect environmental surfaces in patient care areas, healthcare workers should do the following procedures. Use EPA-registered hospital detergents and disinfectants and use them in accordance with the manufacturer's instructions. Keep floors and tabletops visibly clean by cleaning them on a regular basis and clean up spills promptly. Clean high-touch surfaces such as doorknobs, light switches, bed rails, faucets, and toilets more frequently than minimal-touch surfaces such as walls, blinds, and curtains. Clean mops and cloths after use and allow them to dry before reuse, or use single-use disposable mop heads and cloths. Avoid dusting methods that disperse dust. Keep vacuums in good repair and equip vacuums with HEPA filters. Proper documentation. To reduce liability, healthcare workers should keep proper documentation. In other words, they should properly record all aspects of patient care, including maintaining patients' medical records. In addition, if healthcare providers warn patients of a potential danger and patients ignore the warning, the patients, not the healthcare providers, are responsible for any injury. Healthcare workers should be sure to document if patients disregard such warnings. For example, a man has been taking aspirin daily to reduce the risk of heart disease. Recently, he has been experiencing heartburn and stomach upset. The man's physician recommends that the man stop taking aspirin because it increases the risk of gastrointestinal problems. The man disregards the physician's warning and continues to take aspirin. If the man's stomach upset develops into greater gastrointestinal problems, such as ulcers, bleeding, and perforations, the physician is not responsible. To reduce possible future liability, the physician documents his warning and the patient's decision. Event reports and anecdotal records. To reduce liability if accidents or violations occur in healthcare facilities, healthcare workers must file event reports. Event reports include the following information: who was involved in the event, what occurred, when it occurred, where it occurred, what actions were taken, statements by any people who were harmed as a result of the event, statements by any healthcare workers who were involved in the event, statements by any witnesses. Healthcare workers must comply with federal laws and the laws in their state regarding event reporting. In addition to filing event reports, if accidents or violations, as well as unusual or noteworthy incidents occur in healthcare facilities, healthcare workers should keep anecdotal records. Anecdotal records are personal accounts of events. Healthcare workers hold anecdotal records in their own possession